of the CPT code book. What is the meaning of this is you can use these codes in all areas irrespective of the location you can use. For example, patient performs FNA in the nervous system. Will you code this or not? Will you code this section or not?
Yes, we can code.
Yes.
Yeah, perfect. You can code. Why means? General means this is common for each and every section, like 1 to 6 series. Okay. Next, fine needle aspiration biopsy. So first we will learn what is biopsy, guys.
Removal of tissue. Some.
Yeah.
Taking sample.
Yeah, perfect. Sample is correct word. Okay. Tissue means, yeah, no need to worry. I will tell. Basically, biopsy we have two types. Okay. Fine needle aspiration biopsy, where patient will aspirate the fluid or fluid sample. And one more is core needle biopsy. Here patient will remove the tissue. So whatever you told is correct, but is one type of biopsy. So total how many biopsy we have? Fine needle aspiration biopsy for tissue fluid removals. Okay, where physician will send samples to the cytology department. Okay, next one is core needle biopsy, where physician will remove the tissue and he will send samples to the histopathology. Okay, for example, in the operative report, a physician will mention, so I have removed the sample and I have sent it to the histopathology. Which one you will code, guys? Fine needle
Core
aspiration.
needle.
Yeah,
Core needle.
perfect. Core needle biopsy. Why means in the documentation, physician is telling I have removed the tissue. So you need to code core needle biopsy codes. Okay. So like that you need to understand. So next we need to check differences again. Fine needle versus core needle biopsy. See here. This is the fine needle aspiration biopsy. See, this is fine needle means basically thin needle. Okay. So what is aspiration?
Collecting fluid.
Yeah. Collecting the fluid. Aspiration means you need to use this keyword for only fluid aspiration or fluid removal. Next one, core needle biopsy. See, this is the core needle. See, what is the thickness of the needle? So this is very fine needle, means thin needle. This is larger bore needle. Okay. So like that you need to understand. Fine needle means simple, thin needle. Here physician will aspirate the fluid and he will send samples to the cytopathology. So this is core needle biopsy. Here physician will send samples to the where, guys? Which pathology?
Histopathology.
Yeah, perfect. Histopathology. Okay. And we have surgical biopsy, where we have two types of biopsies, excisional biopsy and incisional biopsy. Okay. Excisional biopsy means here also physician will remove the or excise the tissue. Most of the time excisional biopsy means removal of the tumor or removal of the tissue. Next is incisional biopsy. So physician will perform the incision at the diseased area and he will take the sample. Incisional biopsy is not excision. Only excisional biopsy is the excision. Okay. So any doubt, guys, here? You got all 4 biopsies? So if you go to interview, they will ask you, what are the types of biopsies? So they will ask you, what are the types of biopsies? So how many types of biopsy, guys? Anyone?
Definite.
4 types.
Four.
Yeah. Tell me.
Fine needle, core needle.
Yeah.
Fine needle, core needle, excisional biopsy and incisional biopsy.
Okay. For example, in the operative report, you see it as, so patient will tell I have patient in the supine position. So I have identified the tumor location of the abdominal area, and I took the sample from uh, the tumor. Which code you will use?
Excisional biopsy.
No. Here you need
Excisional
to use
biopsy.
incisional biopsy. Why means here physician is not telling I have removed the sample or I have removed the tumor. Just he took the incision and he removed the tissue. That's all.
Mhm. Mhm.
So you need to use incisional biopsy. Anyway, we don't have any incisional biopsy code, but definition wise you need to use. And one more concept is, for example, patient is having tumor on the leg area. So physician has performed biopsy as well as excision at the same location. Will you code biopsy separately or not?
No,
No, it's included
excision.
in the excision.
No need.
Yeah,
Only
perfect.
excision.
Yeah, you need to use only excision. You don't need to code biopsy. Why means all procedures includes biopsy is the component procedure. You don't need to code biopsy separately along with the excision. But in one scenario you can code. Where do you code?
Different
Perfect.
si-
Yeah.
site.
If the patient performs this biopsy on the arm area, okay, excision on the leg area, you can code them separately. Okay, like previously we have seen, correct? So separate procedure concept. So like that you need to understand these types of biopsies. So you can't code biopsy along with the excision if the patient performs both biopsy and excision at the same location. But if the patient performs biopsy and excision at the different locations, you can code. Okay. For fine needle aspiration biopsy, your keyword is fine needle, and patient must need to be remove fluid sample. For core needle biopsy, your keyword is needle. If you want to code core needle biopsy CPT codes, patient needs to remove the patient needs to use the core needle. Needle is the keyword. The documentation contains needle. You need to use core needle biopsy. For excisional biopsy, patient needs to remove the whole tumor or diseased area. Okay. In the incisional biopsy, patient will create the incision. He will take only sample. He will not excise the whole tissue. That is incisional biopsy. In the excisional biopsy, along with the sample, patient will remove the whole tumor. So that is the difference between excision and incisional biopsy. These are very, very important. You need to remember. So for example, in the documentation you will see, so patient will tell, so I took patient into the operating room and I placed the patient on the supine area, and I have used needle in order to remove the tissue. Sorry, need, I used needle to remove the sample, and I have sent samples to the histopathology.
Core needle.
Which type of biopsy you use? Yeah, perfect. Core needle biopsy. Why means even though fine needle and core needle is having the needle, but here you need to code based on
Where they have sent.
yeah, and also based on the sample type, whether it
Yeah.
is fluid sample or tissue sample. Yeah, whatever you told, that is also correct. So you need to code based on sample type. Okay. One second. Next. Now we will see the codes. So that is very, very important biopsies. So anyway, I will share videos, correct? You can watch later. Okay. Next, we have code starts from 10,021. Finally, aspiration biopsy without imaging guidance. First lesion 10004. Each additional lesion. List separately in addition to code for primary procedure. Okay. So they are telling that you can use this 10,004 in conjunction with 10,021. Okay. Here we will see the, so afterwards we will see add-on code edits. Okay. So they are telling that you can't use these codes with all these codes. We will see soon in the upcoming sessions. Okay. So what is here? Finally aspiration biopsy without imaging guidance. First lesion, each additional lesion. So here physician has performed the finally aspiration biopsy. But physician did not use any imaging guidance. So that time you will use 10,021. That is for first lesion. For example, physician performs 3 lesions. Total 3 lesions. How do you code, guys?
10021.
FNF 3 lesions. Yeah, perfect.
10021,
And then add on
1004.
Yeah. How many times?
two times add-on code.
Yeah, perfect. You need to use add-on code 2 times. Why means they have provided each here. Each additional lesion means you need to code per lesion or each lesion separately. So in our scenario, we have 3 lesions, correct? First one is this one, 10021. First lesion. Next one is 104. Each additional lesion. Okay. Here you need to use 2 times. So whole codes are 121 once, 104 twice. Total 3 codes. Okay. This is without imaging guidance. Next one is 10,005. Finally aspiration biopsy using ultrasound guidance. First lesion, add-on code for each additional lesion. Okay. And here also you can use 10006 in conjunction with 10005. Okay. So they are telling that if you want to use 10006, you must and should need to use 10005 only. You can't use this 10006 along with other codes. We will see practically now. I told you correct add-on code edits. I will show you now. So same here. So this is the, here we need to change the codes. For example, physician has performed one final aspiration biopsy without imaging guidance. Okay, 10021. We will enter 10021 here. Okay, 1. And mistakenly you have coded this one. And physician has performed FNA of 2 lesions. Okay, for without imaging guidance. For example. So you have coded for first lesion this one. And accidentally instead of 10004 you have coded 10006. We will see the edit now. So this is the add-on code edit. See here, add-on code can't be built without a primary procedure code. So we have discussed, correct? So what are the types of edits, guys? PTP edits, MUE edits, as well as what is the last one?
Add-on
Add-on.
code.
Yeah, this is the example for add-on code edit. So what did you get here? Whenever you want to code this add-on code, you need to check the primary procedure. For example, here we will change it to 10005. Now you will not get any edit. Why means we are coding them correctly. So now you don't have any edit. Okay. So like that you need to code. So here access is not mandatory. Okay. If you keep or not keep also no problem. So like that whenever you want to code add-on codes, you must and should need to code along with primary procedure only. Okay. So as in 10005 physician has used the ultrasound guidance, you no need to code ultrasound separately. Simple. Okay. Next one 10007. Final aspiration biopsy including fluoroscopic guidance. First lesion, each additional lesion. And here also you can't code this fluoroscopy imaging code along with this code. So again we will see the edit here. So for example, mistakenly you have coded 10008. So mistakenly you have coded 10008 as well as fluoroscopy also. What is fluoroscopy code? 77002. So now you will get the edit. So why did you get this edit, guys? One second,
The
8 and 9,
add-on code we
correct.
cannot use
Yeah, perfect.
without primary.
So why means here they are clearly telling 77002 is bundled into 10008. Okay, so they are telling this 10008 already includes imaging guidance. You no need to code separately. For example, if you remove this one, you will not get any edit. Okay, so how do you stop this edit? Add-on code can't be built without a primary procedure code. So what is the solution for this edit?
Primary procedure
We
need to
need to
enter.
add the prime.
Yeah, what is the primary procedure for 10008? See your CPT books.
1000.
100? Which code? So try to use your CPT books. So then
7.
only you can, 7, perfect. Now you will not get any edit. Okay, so like this, you need to remember this. Next we have FNA, including CT guidance, first lesion, each additional lesion. Okay, here also same guidelines. Based on number of lesions, you need to code. And also you can't use imaging guidance separately along with 10009 and 10010, as imaging guidance or CT guidance is already included in these codes. Next we have final aspiration biopsy including MR guidance. Here also same scenario, first lesion, each additional lesion. So you need to code each additional lesion separately. Here also same guideline 77021. So do not report 77021 along with 10011 and 10012. Why means already these code descriptions are having MR guidance. So you don't need to code MR guidance separately. Okay. So basically these all are 5 needle aspiration biopsies. 1000212, this one 10012. These all are 5 needle aspiration biopsy where physician remove the sample as what, guys? Sample as blank.
Fluid.
Perfect. Yeah, sample as fluid. So that time you can use these codes. If the physician performs tissue sample removal using the needle, you need to use these codes. So for percutaneous needle biopsy other than fine needle aspiration, see here, other than fine needle aspiration, 190-812-86 for breast. Okay, 20206 for muzzle. Okay, 32400 is for pleura, 32408 for lung or mediastinum. Like that, based on anatomical area, these all the codes are related to tissue removal, not for fluid removal. Okay, so like that you need to code these procedures. Here we have one important concept. So how do we code if the patient removes multiple lesions using multiple imaging modalities? Okay, for example, patient has used or patient has performed FNA of 2 lesions using the ultrasound guidance. How do we code, guys? Which codes you will use? See your CPT
One
book.
double one
Yeah,
double
go
zero
ahead.
5 1006.
1005,
Yeah,
1006.
perfect. That is perfect. In the second scenario, first lesion patient has performed using ultrasound guidance. Okay. Second lesion patient has performed using fluoroscopy guidance. So how do we code?
1005 and 1007.
Yeah, perfect. Here you need to use primary procedures. Why means different modalities, correct? So final aspiration biopsy including ultrasound guidance, first lesion. Okay. And next one I told fluoro guidance. So for fluoro you need to use primary code. Basically you need to use primary code if the patient performs different imaging modalities of FNA of different lesions. Okay, perfect. Next, patient has performed 2 lesion biopsies. One FNA using the ultrasound first lesion. Okay. Next one is core-needle biopsy with ultrasound. So FNA with ultrasound and core-needle biopsy with ultrasound. Same lesion. How do you code? So patient has single lesion on the. Yeah, go ahead, go ahead.
Core needle with ultrasound, we will code for same lesion.
Yeah. Here you need to code 10005 final aspiration biopsy. Okay. So here you are using ultrasound guidance, and along with that you need to use core needle biopsy code. Okay. Here you will not use ultrasound guidance twice. Even though physician has performed same lesion different techniques, like FNA is one technique, core needle biopsy is one technique. But in these two situations, physician has used the ultrasound. So you need to use only one ultrasound, which is already in the code description 10005. For core needle biopsy, you need to use only core needle biopsy code. You will not use ultrasound code. Why means already ultrasound included in FNA biopsy. Okay. So got this, guys? Got this one? Different imaging modalities and different types of biopsies and same lesion. So if you go to interview, they will ask you. Patient has performed FNA with ultrasound and core needle biopsy with ultrasound at the same lesion. How do you code? So how do you code, guys? Anyone?
10005 and core needle biopsy code.
So now interview will ask you. So will you code ultrasound one time or 2 times?
One time.
Why one time? Why not 2 times?
One time it's 10005. It's the code description is already states that it's including ultrasound guides for the first three.
Perfect. Yeah, correct. Okay. So like that, you need to use if the same lesion, if the patient performs different approaches in order to perform the biopsy, like FNA and core needle biopsy. You need to use the imaging guidance only once. You can't use twice. Okay. In next scenario, patient has performed like FNA with ultrasound and one lesion and core needle biopsy with ultrasound and separate lesion. How do we code? Here simple. You need to code ultrasound separately. Why separately?
Different
Red
lesion.
lesion. Lesion is
Yeah,
different.
perfect. Yeah, lesion is different. Perfect. Okay. In the next scenario, FNA with ultrasound, core needle biopsy with fluoroscopy. How do you code? First lesion, FNA with ultrasound. Okay. Second lesion, core needle biopsy with fluoroscopy. How do you code? Same scenario, na?
Both we need to code.
Yeah, perfect. Here directly you can use fluoroscopy. Why means 10005 does not have fluoroscopy, correct? You can code the fluoroscopy separately along with your core needle biopsy. Okay. Your side, you need to watch this video before next week's session. Okay, so that if you have any doubts, I can clear you. Otherwise, I can't do anything. Okay, try to watch the video once. And if you have any doubt, please mention in the please ask in the upcoming sessions. So, does anyone has any type of confusion? Otherwise, we will start another section. Okay. So what is important here? Whenever you want to code FNA, first you need to check whether patient has used the imaging guidance or not. Okay. Next, you need to check what is the next keyword, guys? What is the next keyword?
Any add-on code.
So add-on code means when do you use add-on codes? Yeah, no need to worry. Next, you need to check how many FNAs
Patients.
performed
Yeah, how many?
or how many lesions. Okay. Next one, very important. If the documentation contains imaging guidance, you need to check type of imaging guidance. Okay. Next, you need to check what type of imaging guidance. If the patient performs different lesions, different imaging guidance, you can code them separately. Okay. If the patient performs same lesion, different modalities or different imaging, you need to code them separately. Why means approaches are different. Okay. So like that, these are the important concepts you need to remember for your live coding. But you no need to worry. FNAs mostly you will not get. Only core needle biopsies you will get. Okay. FNAs 90% you will not encounter in the live coding. But interview purpose, these are very important. Okay. Next we will start integumentary system.